Good afternoon. My name is Chad Davis. Today I want to discuss a little bit about instructional goals and um, learning outcomes, discuss the differences between the two. Instructional goals are defined as the activities and behaviors that the student will learn or be able to perform after instruction, indicate the context in which the behavior will occur. An example of an instructional goal might be the student will learn about the signs and symptoms and typical presentations and treatment of the hypoglycemic patient. They require the student to be an active participant in learning. Students should be sifting through the material and information being presented and be challenged to engage with it frequently and understand how to apply it into practice. So, if we take the previously discussed statement, the student will learn about the signs and symptoms of the typical presentations and treatments of the hypoglycemic patient. Um, Students should ask themselves, what are the signs and symptoms of the hypoglycemic patient? How will the patient present? How is this different from the signs and symptoms of other disorders? And how do I treat the patient? And then the teacher should take this logical thought process and organize the lesson in a manner that the student will understand and be able to build their knowledge. It wouldn't make sense to try to teach a student how to treat a diabetic patient without teaching them how to recognize one. So, you take the instructional goals and we try to build towards the learning outcomes. Now, learning outcomes are the statements that describe the learning that the students will have achieved and be able to reliably demonstrate at the end of the course. So, an example of a learning outcome statement would be the student will be able to successfully identify and appropriately treat a hypoglycemic patient. Um, Learning outcomes help the student to focus the information learned during instruction. So, for instance, if a student is faced with an unresponsive patient, they should rely on their critical thinking and questioning to reliably assess that patient and determine the reason for their condition. Um, they might recognize unresponsiveness as a symptom of hypoglycemia, but there's several other symptoms that would lead them to hypoglycemia. So they should start to try to question their pathophysiological processes and narrow their focus down to symptoms that are consistent with hypoglycemia or otherwise. That might be something like diaphoresis, cool pale skin, glucometry, stuff like that. Um, so our challenge as instructors is how do we get our students to be consistent and reliable in achieving the learning outcomes. And if we take the case of the hypoglycemic patient, we need to engage our students frequently with that information and build upon their knowledge of the pathophysiology so that they're forced to critically think and understand why they're seeing what they're seeing. Um, we might challenge the student to understand why diaphoresis would be a symptom, and they would rely on their knowledge of the fight or flight response and be able to apply that to the hypoglycemic patient and um, other forms of shock. Um, and then you might take irregular respirations and use that as an example to illustrate impaired brain function as a result of low blood sugar. So if we take that, force the student to engage with that frequently, it might just be pent up in their head without ability to apply it. So we as teachers need to try to engage the affective domain, and we could do that by showing a video of Kussmaul's respirations so that the student will see it, remember it, be able to retain it, and then apply it later for the successful achievement of the learning outcomes. And that's um, how we can use learning outcomes and instructional goals to engage our students so that they can be successful and engage their critical thinking. Thank you.